Welcome to Comrades, a broadcast presented by StrikeMap UK. My name's Henry Fowler and I'm a co-founder of StrikeMap with my good friend and comrade Robert Paul. Starting in late 2020, StrikeMap is a digital, worker-powered map which encourages workers, stewards and reps to upload their action and helps us all share solidarity with those taking that action and hopefully encourages workers' struggle. This is our third show, so please follow us, join us, subscribe and share our content via your social media networks at StrikeMap UK. This is a very special show tonight. I'm joined by two amazing rank and file organisers from across the union movement globally as we discuss organising during COVID and the future of healthcare workers. So I want to start by introducing our fantastic guests. And first of all, I want to say thank you very much for coming and hello to Dominique and Holly. To start with, for people who don't know who you are, would you mind introducing yourself, maybe Holly first, if that's okay? Thank you, Holly.
Thanks, Henry. Yeah, my name's Holly. I'm a nurse in Essex in the UK. So I was part of the group that started the, I suppose, grassroots network of NHS workers called NHS Workers Say No last summer, mid-2020, and sort of got going with the NHS Pay 15 campaign. And here we are. I didn't necessarily think we'd still be here when we started it last July, that we'd still be campaigning and thinking up new ideas to organise. But yeah, here we are.
Fantastic. We're all with you, Holly, absolutely, in the UK. And Dominique, thank you so much for being here. Could you introduce yourself for us?
Hi, yes, thanks for having me. Dominique Muldoon. I'm from Worcester, Massachusetts in the States. I work at a community hospital. We've been unionized for about, 21 years now. In order to become unionized, the nurses before me had to go on strike for 49 days to get a contract. And 20 years later, the same company has pushed us out the door again. We've been on strike for 18 days now, with a myriad of problems, but that's where we're at today.
Fantastic, thank you both. And we've covered and supported both of your campaigns through StrikeMap. So I guess today really is about a mutual exchange of ideas and the fantastic work that you're both involved in your your organising situation. So I wonder if it's okay to start with a kind of section that's looking back, like we hopefully, I mean, it's not 100%, and we know that in the UK, certainly the government's handling of the crisis has made this prolonged and it has been poorly handled. But I want to look at organising during the pandemic and ask you some questions. I'm interested to hear about your conversation together. So I guess probably to Dominique first, maybe. So how has your union been organising during the pandemic? What's that been like in this very difficult set of circumstances?
We faced a lot of challenges during the pandemic. We were actually in negotiations for our contract, and we've always had in-person negotiations. We invite our nurses, we get a big room, they can hear everything that's said, they can see administration's reactions as we're presenting proposals and as they're. So during the pandemic, we always do, staffing's usually always a big issue, and we do a staffing presentation. We invite the nurses to come and tell their stories of what it's like to work on the floor and when we don't have enough help or have what we need. And we had over 200 nurses come. That was March 11th. On March 12th, they shut the state down for COVID. Even on March 11th, the 200 nurses, they would only allow, I believe, like 25 people in the room. So nurses were leaving and coming in because there was so much interest in the process and interest in telling their story. Everything shut down, and it just was, we had to really like pivot and do a whole new, had to learn how to do Zoom like everybody did. There was no in-person anything. So for a bit, we kind of just, we're in a stalemate there. And, we learned how to do Zoom. We started having union meetings on Zoom. Started to do a little bit of one-on-one with members, walking through the hospital, passing out buttons and flyers. Obviously, we couldn't do it in groups, so we had to be very careful for that. But once the state shut down, the hospital was pretty much overrun with COVID patients, and we had all kinds of problems. So it did affect and slow down our ability to get information out there to our members. And we're starting to recover now, but in the beginning, it was very difficult.
Fantastic. And I'm sure some of that is similar, Holly, in terms of your experience working with colleagues in the UK. How's that organising been? We've featured on these calls with different comrades over the last couple of weeks, how important Zoom and other technologies have been. Has that been similar in terms of what Dominique was saying?
Yeah, like everything Dominique was saying, I was just nodding along with all of that about kind of getting to grips with all the technology, and then suddenly we're trying to design flyers and getting familiar with using Canva and all these programs, and suddenly you're producing stuff and you're like, oh, actually I did that, that's not too bad. I mean, I guess you build up a bit of a network, don't you, and you find who's got the strengths in which different pockets, so that's really helpful. And also what Dominique was saying about how the engagement and I suppose the energy can fluctuate with where COVID is at the time and what the sickness rates are like, because I know that in the UK over Christmas, when our hospitals were hugely overcrowded and the infection rates were unbelievably high, I know that the energy levels completely went from our campaign because everybody was just focused on tackling the pandemic. So yeah, involvement definitely fluctuates there. That's been tricky.
Yeah, I think that's only natural. I mean, I guess starting with you, kind of, Holly, then what issues has the pandemic highlighted about the state of healthcare in the UK, I guess, and then I'll ask the same to Dominique, but around worker safety in hospitals, thinking about some of those staffing levels, which are very close to the dispute in Boston, and bed capacity, PPE, all of those things, which have been incredibly difficult. What has the pandemic highlighted about those things in terms of the NHS and the colleagues you're organising with?
Yeah, I mean, I think actually being part of this organising group has highlighted more to me than I ever would have been aware of, because we've got such a big network of us all over the UK and we're on a lot of group chats and we're engaging with each other. And I think we've actually turned into a bit of a mutual support group at times. So it's helped me be aware of, because obviously I work in my specific field, but I'm hearing from people, I mean, we know how diverse and broad nursing and healthcare is, so I've been hearing what it's like on the ground in all these different areas, and it's been incredibly tough. We know that we've got in the UK the lowest amount of ICU beds per capita per person for Europe, and that's been really evident with people, healthcare professionals, having to make beds and make wards where they wouldn't have usually been, and ICU nurses are working on ratios they kind of never ever would have done before, up 1 to 3 plus when they'd usually be working 1 to 1, which is obviously risky, and then it's also really physically and emotionally just exhausting for the workers. And we also know that in the UK we were in a position, especially over Christmas, where we were seeing lines and lines of ambulances piled up. And we know that recordings of non-COVID excess deaths were higher. We can't be sure what that's related to, but it may very well reflect the fact that there has been pressure on care pathways for other conditions, and that I think has just highlighted the real vulnerability we've got in healthcare services, that it's almost like we've been running on an absolute wire for so long, and at times I reflect on it, I'm amazed that we've made it through. I am amazed that the services have kept running.
Yeah, I mean, 10 years of austerity, enormous cuts from central government, devastating bits of the NHS, and privatization through the back door in lots of cases has been a toxic combination when then you're forced with a global pandemic. And I think it's highlighted to a lot of people, certainly outside of healthcare, and obviously to you and colleagues working in the NHS about the impact of those things. So for you, Dominique, then what has the pandemic highlighted about the state of healthcare and worker safety in hospitals, and obviously very close to what's happening at the moment in your area?
So right now we're having a little bit of an uptake, but we're getting, things have stabilized somewhat. Hospitalizations were down. Now we're starting to see them rise a little bit. We don't know where that's going to go, but it's been such a challenge here because, we were just not prepared for this in the United States. They had some kind of a federal resource that was supposed to have a lot of emergency PPE. And, when they brought that out, it was, gloves that were child size or, torn gowns. There was just not enough. And then there was the problem with, shipments getting stolen because all over the world we were all going through the same thing. So, hospital buyers would show up and there would be no shipment because it would go to the highest person who, came and offered the most money. And, we were at one point we were reusing PPE, we were getting sick. And, we never knew if we were buying, we were buying raincoats off of Amazon, stocking up on garbage bags because we just did not know from one day to the next what we would have to be able to take care of patients. At one point, we were working in precaution gowns that were made out of airbags that Ford Motor Company had somehow made for us. But of course, a lot of us are petite women, and we had these big, heavy vinyl, extra large gowns that came down to our feet and, didn't fit properly, didn't wash well. And, it was a struggle all around. And certainly the ICU bed issue, our union the first time around had a lot of difficulty trying to come up with an agreement with the administration. We basically came up with our own plan. We had recovery nurses who made a makeshift ICU with extra beds in it so that when we had those extra ventilated patients, we would have a place for them. And we had nurses who were ICU nurses that, went to different specialties, and they just basically all pulled together, worked all different shifts that weren't even their own shifts to staff this ICU, this makeshift ICU plus our ICU proper. And it was, basically nurse driven because there was just no agreement. There was management and administration was very reluctant to come up with any kind of, we wanted proning teams, we wanted extra help to try to turn these patients so they could breathe. And, it was a struggle that way, and also having a struggle of actually caring for the patients. So it was kind of like a double-edged sword there. We also had, we were on the med surg floors, we were caring for patients we had never cared, in acuity wise, caring for patients that really were more ICU level patients. That was difficult, exhausting. The one thing I can say is that we have a pretty tight community. We do have our hospitals in the city, but like the community was so great pulling together for us, sending us cards, and they'd send us in meals because they knew that we were working extra hours and everything. But it was not a well planned out response to the pandemic, in my opinion.
Yeah, I can see Holly nodding there as if to say, yeah, that's something definitely shared. I mean, that's some amazing story there and testimony about what was happening on the front line in your area, Dominique, and quite shocking really to hear that. But I guess to you, Holly, then we've heard about some of these challenges, but what is it, what have, you know, union groups or groups of workers that are being relied upon in healthcare so much, what kind of things have they won, and what kind of things have you had to work together? And this may be other colleagues' stories, not specific to your workplace, but people have had to come together and try and work with management to find a solution, or to, you know, to have those battles about what's needed for us as frontline workers as opposed to administrators or managers. Could you talk about some of that for us?
Yeah, I think, I mean, I was just nodding along to so much of what Dominique was saying there, like of how everyone just was completely unprepared. It was just completely unexpected, and we saw it coming slowly, and then it just seemed to just bang and explode, you know. And I think people have, what I have seen from a lot of people is increased union engagement and increased union involvement, and people understanding the value of having your union and how they will support us with so much of this stuff, you know, in particular the issues that there've been with PPE, and that continues. I still speak to people who are being sent, you know, rather than sufficient gowns, people are still getting, you know, the flimsy plastic aprons with sleeves that tear as soon as you put your arms in. And this is still happening. You know, people say that that stuff's gone away, but it hasn't. And we do have our unions behind us battling for us to try and get better for the workers and make working environments safer. But it's not easy. We've got a huge challenge because the government just wasn't prepared, were they? So what we needed just wasn't there. So yeah, that's one thing that I think I've seen through this, and that's been good, and that I hope follows through with healthcare workers, is that union engagement and the understanding that your union aren't just there as the kind of insurance claim if something goes wrong, but they're there to make the working environment safe for you, and your involvement in that is key. So I hope that that's something that sticks, and it changes the mentality around what the union's there for.
Yeah, I mean, certainly in the UK, we've seen a large rise in people joining unions, people getting active in trades unions, and them becoming even more relevant than they ever were to working people's lives. There's no doubt about that. And, you know, we share that view, Holly, that we hope that continues. I guess to you, Dominique, then, what does that look like in terms of recruitment? Has recruitment risen for the trades union members? Have you been able to recruit more people? And because of the immediacy of the problems around safety, being able to organise people in an easier way, as opposed to in periods of peacetime is the wrong phrase, but you know what I mean, outside of a pandemic. And then I guess to finish on, I'd be interested to know if you think your union is stronger, weaker, or has stayed the same as a result of the pandemic.
So I would say that I think organizing has been better. We're seeing some hospitals that never were unionized taking votes now, you know, and it is a result of the pandemic. You know, as a union hospital, we struggled with PPE and everything, but I believe that the non-union hospitals had an even worse time because they were just told, quiet down, no, and that's it. Where we would put up a fight, and it was a fight. You know, sometimes it was over stupid stuff. You know, my favorite story is, you know, at one point our CDC said that you didn't need bonnets for your hair when you were caring for the COVID patients, and you know, there was pictures going around of all the different countries, how the nurses were getting dressed for the COVID patients, and they had all the other countries were in these great big bunny suits with the helmets and the respirators. Then they had, you know, the nurse in the United States with just like, you know, her regular scrubs and a little mask, and that's it, you know, and that's what they were trying to promote. And so we had some bonnets that we just had as a floor, and we had administrators come and try to take them away from us because the other floors they had more than one floor that was COVID. So they said, you know, everybody's going to want it if we let you have it. And we're like, well, this is ours. It wasn't even our administration, you know, and they brought like a couple of administrators and had like a showdown with us at the nursing office, telling us to all take off our bonnets because we weren't allowed to wear them. Wasn't recommended by the CDC, and I stood there as a rep saying, no, nobody take off your bonnet. And there was probably 10 of us, nurses aides and nurses, and nobody took off their bonnets. It was like a whole big thing. They unlocked the boss's office and were going through our drawers to see if they could find the bonnets and dispose of them. They called security, never did find the bonnets. And, within a week, everybody was allowed to have bonnets. And it's such a silly thing, but it was a huge win for us. It empowered nurses so much to say, hey, this is wrong. We're not going to stand for this. And that's what we kind of noticed during the pandemic. When things were going wrong, people were reporting it to the reps. They were, calling us on the phone, sending us text and things. And we would carry the fight, and we didn't always win it, but that resistance, I think, prevented, worse problems. So I think that has been, some people might say, oh, that made the union weaker because they didn't win all the battles, but I think it made us stronger. It made nurses stand up and fight, and we're still fighting, but I think we're a lot stronger because of the struggle and because of the fight.
Absolutely, and the Battle of the Bonnets sounds excellent. So thank you for sharing that. It's a really good example of that kind of resistance and collectivity at the workplace and how that can play out. I guess, Dominique, it's quite an interesting dynamic, which maybe isn't quite the same on, I don't want to speak for healthcare workers in the UK, but can you just explain how some hospitals aren't unionised, but some are, and what your linkage with those hospital workers is? And, if some of those have become organised or have, taken steps to becoming organised as a result of the pandemic. It's quite an interesting dynamic that may be for us.
So we have in Massachusetts, we have pretty much one union that represents nurses. There are other unions around. So we have different nursing unions that, represent all around the whole country. We have the Massachusetts Nurses Association, and I think we have 123,000 nurses in our union, and it's growing every day. There's also a National Nurses United union that, they kind of organize nationally in places where there isn't a really strong state union.
Right.
We have PASNAP, which is Pennsylvania Nurses Michigan. So I think it's kind of like on a state by state level, and then we do have some. We're just starting to do like the national unionizing, which has been a really strong movement. We also, I don't know if it's the same, I'd be interested to hearing what Holly says about it, but we have like a public and a private sector. So we have some hospitals that are state run, and they're a little bit different. They're unionized, but the rules are different. I work for a for-profit hospital, that is not private, and they basically make money off of sick people. So nurses are fighting, in the States, we don't think it's a bad thing to make money, but we don't think you should be taking advantage of, that kind of thing. You have to put money back in the business and take care of the people who are coming to you for care. So it is a little bit different over here, unionization.
Yeah, that's really interesting. I'm going to let Holly answer around experience in the UK, but while you're answering that, Holly, I guess, what do you think about, has your union or unions in healthcare that you organise, campaign with, speak to, have they become stronger, weaker, or do you think stayed the same during the pandemic?
From my experience, I think they've got stronger. I think they've got much stronger because I think the members have become a lot wiser to how the unions work and how the processes work. I mean, I can say myself, I was probably in a union for about 10 years, a nursing union, without really getting that engaged with them, without really understanding the processes of the pay review body and the various things and the different ballots, how it would all work. And I think people have really, got quite clued up, because I think a lot more people have become union reps as well. So I think there's a lot more conversations happening in the workplace about the power of being in your union and encouraging people to be members of the union if they're not, because there's still, in the NHS, throughout all the employees, there's still a lot of people that aren't in unions. So yeah, I think the unions have become stronger for that. And I hope that maybe with how there's so many grassroots activists now, that I think perhaps they've I like to think they've pushed the unions into action a little bit more, especially around our pay. Like, there's kind of 4 leading unions really in healthcare. There are some other ones as well, but they're all kind of really going for it now with the campaigning and organising. And I think that's through people who want to be really active, becoming reps, becoming branch members, sitting on the councils and really pushing for it. So yeah, I definitely think they've got stronger.
Fantastic. And I want to kind of move on now to kind of look forward to the kind of the present, really. If we've looked at the past and the challenges, but sounds like to me that people are coming out of this stronger, more organised, certainly in both your examples. So I want to talk about the kind of now, and I think I'll start with you, Dominique, so you can just talk a little bit about the strike action that you're involved in. But I guess I want to ask of both of you, starting with you, Dominique, about what campaigns, disputes you're currently involved in. I'll come to Holly and to talk about what's happening in the UK around that. But if you want to just give some time to your dispute, and like I say, just explain it to people that may not know it. Hopefully they've read our strike story on Strike Map about the strike, but if they haven't, it'd be great to hear from you firsthand. Thank you.
Thanks. Yeah. So this, I would say the strike is, over 2 years in the making. We started in 2019 negotiating and extending the contract. Here we don't, go on strike as soon as the contract ends. We keep negotiating and trying to get a contract and get something we can, agree on. But, throughout, staffing had deteriorated before the pandemic. Nurses were, they just would make sure that we were all at max. And there was always a numbers game being played, so that, if they felt there was too much staff, you had, what they considered to be too little patients, they would even send a nurse home. Or, float her somewhere. It was a real kind of a Russian roulette kind of thing that frustrated nurses, because we couldn't, take good care of our patients. And, seeing that staffing became a huge, huge issue for every single nurse on most all of the units. Even the nurses who feel they're not affected have seen the effects of what's happened, and they're behind it as well, because not only have they done this with nursing, but they have cut ancillary staff. If there's no unit secretary, they want to give the nurse a portable phone to carry around while she's taking care of patients. And if there's nobody to sterilize the machines, they want us to wash those. And it's just everywhere you look, there was some sort of degrading of our hospital and our resources. And so the staffing issue became more and more intense with nurses, and then COVID hit and just made everything worse. And our hospital, we were a smaller community hospital, and we have a couple other union hospitals in the area that, the pay's always been a little better there and the benefits a little better. People stayed at our hospital. We were more of a family kind of environment, but things had gotten so bad that, 100 nurses left out of, 800. Suddenly 100 nurses either left or some retired, but it became a critical shortage because, things were going on with the pandemic, and they were still trying to find ways to cut services and cut staffing and resources for us. Nurses were just, disparaged and demoralized. And, as we kept, marching, trying to get this contract done, and conditions worsened, we ended up, nurses were mad even. At some point, nurses, what are you guys going to do? What are we going? This is awful. We can't work like this, And we took a no confidence vote in the administration and the CEO. In the middle of a pandemic, it was like June, so it was a little bit slowing down the first surge. But the fact that we had 500, 600 nurses come out singly and vote in a pandemic, no confidence was huge. And nurses were wearing buttons and safe patient care, and we just it was like a slow, deliberate march towards this, and we weren't looking. It's always, we have the attitude, hey, let's hope for the best, but plan for the worst. So it was very measured. We obviously wanted to take care of our patients first. We didn't want to be having some kind of a job action in the middle of a surge. So we were trying to just patch things together, get through this, and negotiations broke down, and they started to break down in January. By March, they had completely broken down. Management said, we understand that staffing is an important issue for you, but we don't feel the same. We're not going to, we'll give you a raise, we'll give you better benefits, but no staffing. And nurses were pretty outraged at that because it wasn't about the money. Yes, we want to take care of our families. We want to have, all of that, take care of, but it was about our work, about our patients, and, patients were falling, and we were trying to be in the room to take care of them. Things were happening that, damaged our feeling of integrity of being a good, caring nurse. And, when that happens on a large level like that, it's, that's what brought us to a strike. We took the vote. It was nearly 90% yes. Wow. And, we didn't throw down the strike card. It was an authorization. So we continued to try to negotiate, thinking, hey, management, you guys see what we're doing, you see what we're saying. 90% of our bargaining unit is saying that they will strike if they don't get staffing. Come to the table. Let's have some back and forth. And they gave us this minor little improvement that would only help 2 units out of 12. And that just wasn't going to do it. So we ended up given 10 days notice, and went out on strike March 8th. 700 nurses walked out. It was so unbelievably emotional and also empowering. I mean, we had new grads who walked out crying, and being, hugged by the more senior nurses saying, it's going to be okay. We're going to get through this, but and it's been a roller coaster ride since we walked out. Management has not really reached out to us at all. But, we feel that we are strong, and we are gonna, it's one day longer, one day stronger. We have got to do this. We have got to take our hospital back. That's how the nurses feel. They feel like this is our hospital. We need to take it back and give the kind of care that we know that we can do with the proper resources. And we do appreciate all of, we've had so many letters of interest, and everybody has just been wonderful to us, here and over internationally. We really, really appreciate the support. Thank you, everyone.
Thanks. It's fantastic to hear about the different dynamics and the different phases of negotiation, of workers organising, and how that's broken down. I mean, bring in Holly, but that's very, very different. We don't have necessarily a national bargaining position really in the UK in terms of how that works. So, I mean, Holly, do you want to talk about kind of where the campaigns that you and other healthcare workers are involved in is on the front page of nearly every newspaper at the moment. It's getting ever more press coverage, and your organising and work during the pandemic has been noted nationally, and it's very much in the psyche, I think, of the public, especially coming out of the pandemic. Do you want to talk about your kind of campaigns that you've been involved in or continue to be involved in?
Yeah, so we kind of started, so our campaign is primarily around pay, but the fact that the pay impacts the safe staffing. So I guess what's different to what Dominique was saying is we've got the vacancies there in the NHS. We've got 100,000 vacancies there, but we can't recruit because the pay is poor. And, you know, week on week, month on month, more and more nurses and healthcare staff are leaving because like it just really resonated what Dominique was saying, that you can't give the patient care that you want to, and it's really upsetting as a healthcare professional that cares about your patients, and you know that if you had the resources and the staffing in place that you can do an outstanding job. And I know that a decade ago it was slightly easier than it is now, but you know, we struggled to meet the needs of our patients, and it's really upsetting. So where we are is pushing for that pay rise to make up for the decade of cuts essentially that we've had to our wages, so that we can try and recruit and try and fill some of those vacancies so that we can get to those safe staffing levels. Obviously we had the added complication here that fees have been introduced for student nurses as well, and the bursary's been removed. So a lot of student nurses, I know that at the moment, post-pandemic, the government are saying that the numbers are up for new student nurses, but we know that the dropout rate is really, really, really high because it's so tough on the ward, and because they leave with so much debt to come into a really poorly paid job that is really stretched and feels quite unsafe at times. So that's kind of where we are, and we're waiting for the pay review body to make their offer of what our pay increase will be. They made the offer in Scotland of 4% yesterday, and it looks like the unions are going into dispute over that. So I don't think we're going to hear anything till mid-June now. It keeps getting pushed back and back and back. And then it will be what steps are taken from there. So for our campaign, we're trying to just encourage everyone working in the NHS to get organised within their union, to support the unions in getting ballot ready essentially. Like, it's amazing that the turnout Dominique said that they had, and 90% voting yes, you know, that's just incredible. And I suppose what we want to do as organisers is get to the place that when the unions are going to be balloting, that we can have a turnout and a vote like that. But it's not easy reaching everyone, is it? Like, we've talked about using all the Zoom and the media and all the online stuff, but not everybody uses that. And in a pandemic, it's hard to reach the people that don't access a computer and don't use Facebook and Zoom and everything else. It's not easy. It's a job in the middle of a pandemic.
Yeah, no, it's been a fantastic campaign, and because it's a grassroots campaign that's been working to move unions to taking a position around pay, it's been really amazing to watch it develop. And I think you've all done incredibly well and continue to inspire, I think, lots of group of workers in the UK that are looking similarly. But before we kind of move on, Ollie, do you want to explain that? So unlike in Dominique's position where they would bargain with an authority, that we've got a review body system, haven't we, around pay, so we don't bargain the contract. Do you want to just explain just a little bit of how that works, just in case people are hopefully watching from the US and around the world, just so people know.
So we have the pay review body who set the figure essentially of what our pay rise will be, and the government make the recommendation to them. So they've recommended 1%. Our unions have all recommended mostly between 12.5 and 15%. So the recommendations come in, and then the pay review body will make their offer, which is expected to be somewhere between 1 and 2%. Whether what's been offered in Scotland might influence it and push it a little bit higher, but it's not going to be anywhere near what the unions are asking for. So then it will kind of be down to what position the unions decide to take, and if they start doing some test ballots, some indicative ballots with some of us, which it looks like that's what's going to be happening in Scotland. And in my head, I'm imagining the UK, England following a similar path.
Yeah, I mean, the Royal College of Nursing putting aside an enormous amount of money for the strike fund, for me, signals that, all of the trades unions and those involved in your campaign are incredibly serious about this. And you've said about the huge recruitment crisis that we have now in nursing, and the combination of taking away grants, obviously a very high tuition fee that's increased year on year, as those that opposed the introduction of fees said would happen. But I guess, Dominique, coming back to your situation before we kind of look to the future, I guess, is what is members' energy like? My good friend, I want to give him a shout out now, George Bennett, who I think is a Boston native, who's worked very hard and kept me up to date with what's happening in your dispute. So thank you, George, for that. Has shared with me lots of different articles and people coming to your picket lines, the great support in the community. I've seen you've been doing some community work as well on those picket lines. Could you just describe some of that support? Because I think those things are really important things that we can learn and then develop for if healthcare workers have to take action in this country, and the linkage between community and the trades union and the workers. That would be great.
Sure. And, I'd like to say on what Holly was saying, that's such a universal problem that, nursing's a really tough job. And, if you don't have the pay, and it's largely a female dominated, profession, and the pay definitely and the benefits have to be there to recruit people, just like they do for any other industry. So she's absolutely right with that. As for our, I think that we are really strong right now. It's, we're a couple of weeks into it, going on our third week. We have really a great team, of leadership at our union, which, I'm eternally grateful for. We've had congressmen and senators. We've had so many visitors to our picket line, where, management just wanted to shame us and say, how dare you little nurses go out on strike in a pandemic? Shame on you. And the community gets it. I mean, the whole Worcester community has come around to us, and, every day we're out there, people are beeping at us. They understand. Last night we had this absolutely amazing candlelight vigil, and all different faiths came out, and they said a prayer with us and for us. And they just, talked about, you saying, you nurses do deserve everything that you're asking for. You're not asking for anything that's ridiculous. So, because we often do say, maybe we shouldn't be speaking up like this, but that has really, I think, lifted us all up and encouraged us. And we've had the Attorney General came this week, and she spoke to us, told a personal story that her mom was a nurse. I guess everybody knows a nurse, right? Or you have one in your family. We're a pretty large group. But this has really, I think, every time we've had something like this, our members have all come out to the picket line. We always have a couple, 300 people, and everybody's very engaged in the process. And, it has really made us stronger. We all have started to get to know, like, a lot of times you work in a different unit and you don't meet somebody, you might hear of them. And we have met so many people I've talked to on the picket line have said, wow, I see people I never see, and it's really great. And it's a terrible situation, but I'm just so glad I got to see you today, because I haven't seen you in years. Things like that. We have a Facebook page just for the bargaining unit, which has really lifted us up as well. Everybody's posting our pictures and trying to, encourage and basically hold each other up. When you're having a bad day, you go out to the picket line and you know what, you feel better. You think that it's all, people doing horrible things, but it's not. It's people getting together and supporting each other and, in a really great way. So that's, I think, where we're at is we're really feeling strong and solid, and we need to do this.
Fantastic. Right. We're coming to the end of it now. I appreciate all of your time in speaking about this. It's been fantastic to hear both of your experiences. I want to quickly go to the future. So I'm going to come to you, Holly. So what does the future look like for health workers, probably in the UK, but maybe more broader? And how can we all support you?
Well, I think if we don't push forward with our campaign and win a better pay rise, I think the future looks quite bleak for healthcare workers in the UK. I was reading a report around 100,000 vacancies predicted to rise to 250,000 by 2030, and there's been a lot of our unions have been doing a lot of surveys recently around like the emotional well-being of staff, how staff are feeling, and they're all coming out saying about 1 in 3 nurses want to quit. And that's really, really concerning for me. And I think all that will do is speed up privatisation through the back door, because services will just cease to run, won't they? And these private companies will buy them up, and that will be affecting everybody and what healthcare they're able to access for themselves and their family. So yeah, we just want the public on board as much as possible and everyone supporting us. And it was really heartening to hear Dominique say how supported they've been, and what morale's been like and how the communities have treated them, because I think in our profession we do care what the public think of us. We don't want the public to be against us or think that we're putting our patients at risk, because no one would ever do that. We're doing this for our patients, to fight for them. So hearing that about the public being behind them, I hope that everyone watching this who's working in healthcare wherever is kind of quite heartened to hear that. So yeah, I think we just want people supporting us as much as possible. Anything they can do, like wearing a badge, putting a poster in the window, lobbying their MPs, signing any petitions that they are, and just keeping up the public support, really. That feels really important.
Thanks, Holly. Yeah, proud to have my badge on my bag when I go to work. Absolutely proud to have it. So fantastic. And then finally to you then, Dominique, how can we support you in your struggle? We've got your great strike story on part of our site. We hope that this video will raise some awareness, but it is an important dispute. And in America, from Hunts Point in New York recently to this dispute, workers are organising, fighting and winning. So it's really important to us in the British and wider labour movements. How can we support you?
I think all of the attention and support, the positive press that we have gotten, the press has been really great for us. They get it, they understand what the issue is, and I think it's a huge support. We do have a Venmo account for our strike fund, the St. Vincent nurses. We're trying to get, diapers and formula for our younger nurses with babies, things like that. I think that, as workers, we all have to stick together. And, it doesn't matter where we are, unions, we always say here, unions float the boat here, meaning, we raise the level for everybody. In this country, many years ago, there was no weekends. Unions were the ones who said, hey, we need a day off. And, now it's very common to have a weekend off, not for nurses, but, but we alternate them. And, I just feel that as workers, whether we're nurses or anybody, we do have to support each other. And that's been a key thing in our campaign as well. We've had many unions come out to our picket line and picket while, we're in our union meetings once a week, and, just come and support us. And it's just been phenomenal, how all of the unions have pulled together. Workers everywhere understand, because I think this is like universal issue here, there, everywhere. And we're stronger together than we are alone.
Fantastic. And I want to thank you both very much for giving up your time. We're kind of coming to the end now. So thank you to both Dominique and Holly for joining us. I also want to give a big thank you to my good friend and the tech whiz that makes all of this possible, Mike Jocelyn, for all his help. And also again to our good comrade, George Binet, who had the fantastic idea around this program and is very supportive of those taking action in Boston. This has been Comrades, a broadcast by Strike Map UK. I've been Henry Fowler. Please follow Strike Map UK on Twitter, on Facebook, subscribe to our YouTube channel, and become a signed up supporter today. If you know about a strike, if you know about a picket, put it on our map. Solidarity, comrades, and stay safe.